Hey, welcome back. We are talking about the impact of triple-negative breast cancer with our guest, Dr. Alexander Asaya. This is an extremely important topic. This is a cancer, as we discussed during our first segment, that is found predominantly in Black women and Hispanic women. The difficulty with this cancer is that it starts to metastasize almost immediately, very, very early. Difficult to differentiate early on from other cancers, but once you get it, the symptomatology is the same, is what I meant to say. But once it's identified, it's a cancer that is aggressive in its growth, and it's one that's very, very difficult to treat.
Right.
Yeah. We were talking about symptomatology as we went to break, and so you talked about obviously the self-exam. We shouldn't just rely on the self-exam, should we?
No,
Yeah.
because by the time, and a lot of research has already shown that even when you go to the mammography and you find a very small spot, that tumor has been there for 5, 10, maybe even 15 years.
No kidding.
That's right. So the tumor, what happens is cancer or tumor is defined as uncontrollable growth of cells.
Right.
So any cell in our body can become cancerous. And early on, the immune system tries to manage to kill the cancer, because once it becomes, so it has an on and off signal. So we have in our bodies cells that always divide. So what happens with cancer, with a normal cell, it'll divide once or twice, 3 times and stop. And then that's how you maintain yourself. But cancer cell will continue growing. It has no off signal. It just keeps on dividing. And in fact, in our lab, we have some cancer cells taken from patients in 1952, and they're still growing in our lab. The patient has died long ago, but the cancer continues to divide. And these are the cells we use to try and make new drugs and try and understand why the cancer is so devastating.
So what do we do about this? And I want to mention to you, too, that you're going to have the opportunity to hear a lot more about this particular issue. The doctor has an event coming up at the University of Toledo on February 24th. And we will talk a little bit more about that before we leave today. But this is frightening. This is absolutely frightening. What do we do about this?
It is. I think awareness is key to helping all the women who have triple-negative breast cancer. But there is hope, because researchers like myself and others are really working to try and address this cancer. One thing that they've identified are other markers. So in our labs, because they don't have the classical, remember you mentioned HER2, the progesterone and the estrogen, we are now investigating to find other markers that we can identify early on that this is a triple-negative breast cancer, and then therefore attack it with different kinds of drugs. These are called, we're doing biomarker discovery to find other markers that haven't been classically identified. And then other tools, for instance, now there's something called immunotherapy. And that is really it's cutting-edge technology, and it's inviting your immune system to kill the cancer. So, and
that actually has been shown effective in the treatment of some other cancers.
Yes, a lot, lung cancers and other, and now we're introducing it into looking at triple-negative. So just one way of looking at the immune system is when you're a baby, you get measles, mumps, and rubella injection vaccinations, and then lifelong protection. Your immune system identifies it. Even in your 80s, you'll still be able to play with babies who have measles, and you won't get sick at all. So that's just how powerful the immune system is. So with these immunotherapies, we're trying to train the immune system, the person's own immune system, to identify the cancer as being devastating and kill it before it can divide and grow.
So there are strong looks being taken at the way to manage this cancer.
Yes.
If you have it, though,
Yes.
is the way that it's being treated right now just based on, as we talked about, a personalized approach? Because generally it's a resistant
Yes,
cancer.
unfortunately not. So we are trying to educate a lot of the doctors because normally when a woman gets triple negative breast cancer, they are given the chemotherapies. So chemotherapies came about is chemical-based drugs. So what happens is they are since I defined cancer as uncontrollable growth of cells, so they devised drugs that would kill all rapidly growing cells. However, which is good because it'll kill the cancer cell.
Right.
But there are other cells in our body which are growing as well. And that's why women get such bad side effects. You know, the lining of the stomach is still growing. You know, your brain cells, so that will kill all rapidly growing cells. So that's why huge side effects are there. And so triple negative breast cancer is still being treated with chemotherapies, which are not very effective.
Not very effective.
So we need to get targeted therapies like immunotherapies, which are going to target the immune system, or others which are going to target proteins which allow the tumors to grow or to destroy the cytoskeleton. You know, because
what amazing work!
Yeah.
What amazing work you're doing. Gosh.
Thank you.
So what will we learn at the conference next week?
Oh, it's going to be a great conference, and I want everybody to come over and see, because we're going to divide it into talking about the research, rapid research which is being done. We're going to have community leaders out talking about awareness, and other doctors talking about the question of how the symptomology of breast cancer is. We're going to have question and answers. Students will be there, and you know, we welcome anyone to just come in and ask the questions that they're usually shy to ask.
And it's free.
It's free too.
Parking is free. And let me give you the location. I'll give you this again before we leave. But it's February 25th, 5 o'clock to 8:30.
That's right.
And it's at the University of Toledo Health Science Campus. Did I get that right? That's in the Health Science Building. That's on Transverse Drive for people who don't know where that is. And just come over. There's so very much to know about this. We have just a minute or two left. I wanted to make sure, though, that we talked about that conference. Just a minute or two left. Do women of color need to be frightened? Do we need to... We've got so much to be concerned about already. Is this just one other thing that we need to be concerned about?
Concerned but not frightened,
Okay.
because there is hope and there's awareness, and we want the women of color to be understanding enough so that if they do get triple negative breast cancer, they'll know how to talk to their physician, because many times if their physician is not aware of the new drugs that are being out there, the new therapies, that is wrong. We want them to come out and say, look, don't treat me with the old chemotherapies. I want the new drugs, because there are new therapies, immunotherapies being used. So that's what the awareness will bring them. That's what we want them to know.
And it's so important to be your own advocate in these processes and to challenge. It's okay to ask questions if you don't understand. We don't want to leave people, though, today with the thought that triple negative breast cancer automatically means that it's a death sentence.
No, you're right. There are ways of, as we said, early detection is one thing. So early detection is very good. Using the new types of therapies, being aware, and it's not a death sentence. It's not a death sentence.
Is there anything that we can do with our diet, or is there any? Would you quickly?
Yes, quickly. I'll talk about the diet. It's been shown that a high meat diet is not very good. Moving to
any kind of meat, or red meat?
Red meat in particularly. Move more to fish and the like, vegetables. Reduce on the red meat, I would say, yes.
And generally exercise and those kinds of things are important as well.
Yes.
Are those helpful in prevention? Do we know that yet?
We do know that it is really is very, those who have a less red meat diet have been shown to have less incidence of cancer.
So
those
it's just
who
not
have more
something that we
exercise.
do after it's diagnosed. It's something we should be doing.
Please do it before, yes.
Beforehand. Thank you so very much
Thank you
for
for
joining
having
us
me.
today. We've got lots more to talk about, so
Yes.
we do. I'll be calling you. You've got to promise to come back.
I will. Thank you very much.
so much. We're
Thank
going to
you.
go away. We will be right back. So we've been talking this morning about the impact of triple-negative breast cancer. Again, this is such an important issue, especially if you are a woman of color, if you are Hispanic. This is a very difficult cancer to treat, but there are options. There is hope, and there's a conference that's going to be talking about that. And this conference, again, as we mentioned earlier, is February 25th, 2020. And doctor, again, the importance of attending this conference.
It's really important to attend the conference, especially women of color, those who have breast cancer, those who have relatives who have breast cancer. It's a very important conference because it's going to give you awareness and hope. We're going to have a lot of different kinds of people, scientists who will talk about the new technologies. We'll have clinicians who will talk about the therapies that are there.
All of this is designed to help people have a better understanding of this cancer. Thank you so much. And again, it is February 25th from 5 o'clock p.m. to 8:30 p.m. at the University of Toledo. It is free. And parking is free as well. You guys, you know the rules. Go out, find a way to pay it forward. Please be kind to everybody. Every month ought to be Black History Month. I'll see you next time on Bridges.